announced by the Minister of Health over the weekend are the latest in our community to have succumbed to the coronavirus. This is a harsh reminder that this virus can be fatal and that we must do all we can to protect ourselves and one another. Beginning tonight, our press conference format will change slightly. We aim to give shorter statements while highlighting the most important information to the public in regards to COVID-19. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide us with an update on the latest COVID-19 test results and vaccination statistics. Following the Minister, I'll review our current status and the factors the government is taking into account when deciding whether or not more measures may be required. And I'll provide a brief update regarding schools on behalf of the Minister of Education, who will join us at the end of remarks to answer questions from the media. I do want to remind members of the media that the Minister of Education will be giving a full press conference tomorrow at 5:30 p.m., but he is here to answer any questions which you might have today. We are also joined by the government's Chief Medical Officer, Dr. Oyinloye, who can answer any medical questions from the media. And also tonight, Dr. Ayo has support as we have another doctor and the Bermuda Hospital Board's Chief of Staff, Dr. Wesley Miller, who can also answer any questions regarding the hospital that members of the media may have. But first, we'll hear from our Minister of Health. Minister?
Good evening. Thank you, Premier. I'd like to start by echoing the sentiments of the Premier and extending sincere condolences to the families and friends who have lost loved ones to COVID-19 this past weekend. I will now provide an update on COVID-19.
Do you have her remarks?
There were 731 test results received by the Ministry of Health since the last update, and 28 were positive for COVID-19. This gives a test positivity rate of 3.8%. 6 of the new cases are classified as imported, with details as follows. 1 resident who arrived on American Airlines flight AA308 from Miami on the 21st of March, 2021 and tested positive on their day 14 test. 1 non-resident who arrived on Delta Airlines DL584 from Atlanta on the 27th of March and tested positive on their day 8 test. And 4 residents who arrived on American Airlines flight AA308 from Miami on the 31st of March, 2021 and tested positive on their day 4 tests. 9 of the new cases are classified as local transmission with known contact as associated with known cases. The additional 13 new cases are classified as under investigation, and these cases are among residents with no currently identified link to other known cases or history of travel in the past 14 days. There are 14 recoveries and 0 deaths. Bermuda has 1,497 total confirmed positive cases. Their status is as follows. There are 670 active cases, of which 649 are under public health monitoring and 21 are in hospital with 6 in intensive care. A total of 813 persons have recovered, and the total deceased is now 14. The mean age of all confirmed positive cases is 41 years, with the median being 39 years, and the ages range from less than 1 year to greater than 100 years. The mean age of all currently active cases is 41 years, with the median age being 40 years, and the ages range from less than 10 years, that age group is from 0 to 9 years, to greater than 80 years, with that age group being 80 to 100 years. The mean age of all of our hospitalized cases is 60 years, with the median age being 57 years, and the ages range from less than 30 years, and that age group is from 20 to 29, to greater than 80 years, and that age group again is 80 to 100 years. The mean age of all deceased cases is 75 years, with the median age being 77, and the ages range from less than 50 years, which the age group is 50 to 59, to greater than 80, and again, that age group is 80 to 100 years. The source of all cases is as follows. 251 are imported, 998 are classified as local transmission, of which 906 are local transmission with a known contact or source, and 92 are local transmission with an unknown contact or source, and 248 are under investigation. As investigations proceed, transmission categories may change. Today's update has 29 cases moving from under investigation to local transmission with a known contact or source. Of the over 200,000 test results reported, the mean age of all persons tested is 43 years, with the median being 42, and the ages range from less than 1 year to greater than 100 years. The 7-day average of our real-time reproduction number is above 1, and it's 1.26. I will now provide an update on our vaccine program. We have completed the 12th full week of vaccinations, and from the 11th of January to the 3rd of April 2021, Bermuda has administered a total of 41,152 vaccinations, and this figure will rise to 42,038 if you include yesterday's vaccinations as well, all of which, again, is very, very good news, and it ranks us 8th in the world for vaccinations. Of the 41,152 vaccinations administered for the period that we are reporting on, which ends on April 3rd, 54% of those persons are women and 46% of those persons are men. Bermuda's herd immunity goal will be achieved when 70% of our population has been immunized. To date, 37% of the population has been vaccinated with 1 dose, and 27% of the population has been immunized with 2 doses. 3,364 vaccinations were delivered during the week of March 28th to April 3rd, and the public has accessed these vaccines as follows. The vaccination center at the Bermuda College administered 25,440, or 62% of vaccinations. 14,692, or 36%, were administered by the Bermuda Hospitals Board Vaccination Center, and 1,020, or 2%, were administered at other vaccination sites. Significant progress has been made in vaccinating our population, and especially our most vulnerable. 64% of all residents over the age of 65 have had at least 1 vaccination, with 54% of those being fully immunized. 52% of individuals between the ages of 50 and 64 have received at least 1 vaccination, with 39% being fully immunized. And 22% of the residents that are less than 50 years of age have been vaccinated with at least 1 dose, which represents 1,728 vaccinations in this age group this week. Now, this lower overall number is what we would expect, as this group falls within phase 3, which was just opened up 2 weeks ago. Uptake among the younger age groups is strong, but I want to encourage all of those persons under the age of 50 to register to get vaccinated. At present, only 41% of those in that group eligible to register have done so. Vaccinations are continuing at a steady pace, and we are seeing both the number vaccinated and the numbers immunized climbing steadily each week. This is excellent results so far, and I would like to thank all those persons who have taken the step to get vaccinated to protect themselves, their families, and our community. I want to remind residents that we need everyone who can to get vaccinated. Anyone over the age of 16 or over, can get a vaccination appointment, as we are now in phase 3. Anyone who is between 16 and 18 years must be accompanied by a parent or a guardian, and priority will continue to be given to our more vulnerable populations, including seniors and those with medical conditions. If you have not already registered, please do so by completing the registration form at vaccine.resquest.com/web. Please remember that you will not be vaccinated if you have traveled in the last 14 days. You must have a day 14 negative test result to get either your first or your second dose. Also, if you are in quarantine, do not attend the vaccination appointment. Let the vaccine program know that you're in quarantine and will miss your appointment. The appointment can be rescheduled, and if it is your second appointment, it can be rescheduled for up to 12 weeks from the date of your first appointment. Every dose of the vaccine is extremely important, so if you are unavailable to make your appointment, please call the hotline at 444-2498, selecting option 2, or email vaccine@gov.bm. You may also email vaccine@gov.bm if you require a vaccine certificate. We are doing a tremendous job administering vaccines, now ranking 8th in the world, but we cannot rest on our laurels. The more often people take non-essential trips abroad or take unnecessary risk in group gatherings, for example, the longer it will take for our community to get vaccinated and to protect each and every one of us. This is because we cannot vaccinate recent travelers or people who are in quarantine or in isolation. However, the faster we get to herd immunity, the less likely COVID-19 can get a foothold in our community and the quicker we can get back to our new normal. The question has been asked many times by members of the public whether or not people who have been vaccinated can test positive for COVID-19. If you have been immunized, the risk of you getting the disease is low, but vaccinations do not completely stop you from getting it. However, the COVID-19 vaccine does lessen the severity of the disease and its symptoms. A person who has been vaccinated can have the coronavirus, but show no symptoms or have very mild symptoms of the disease. And that person might pass the virus on to family, friends, and colleagues. The research on this is still underway. However, it would appear that those who are immunized do have a lower viral load of the coronavirus. Notwithstanding this, and because the science is not yet conclusive, it is extremely important that everyone continue to follow the guidelines of wearing a mask, practicing good hand hygiene, and maintaining physical distance. We each have a role to play in stopping the spread of this virus. Those of you who can must work from home. This is the law. Keep your social bubbles limited to the people in your household. There is testing available, and the next walk-in pop-up testing will take place tomorrow at Horseshoe Bay Beach between 4:30 p.m. and 7:30 p.m. Anyone who wants to get tested can. However, again, if you are in quarantine, you must not get tested before your day 14 negative test results. What we are finding is that people have decided that they want to get a test before day 14 and use a different name, perhaps their middle name. We ask that you do not do this. The Ministry of Health staff, working closely with MDL, have discovered these attempts to get around the system. I understand that it is tedious and that it can be frustrating being in quarantine. However, it is also important that all of the quarantine measures are followed fully to help to stop the spread of this highly contagious variant of the coronavirus. If you have a medical emergency, please do not delay going to the hospital for fear of contracting the coronavirus. The hospital is taking every precaution to keep patients and staff safe. BHB is seeing fewer people attend emergency than usual and are concerned that people who need emergency care might delay going to the hospital. Dr. Miller has joined us today at our press conference and can answer any questions that the media may have with respect to BHB. I will remind people who are over the age of 65 and want to get vaccinated that they can also go to the Bermuda College Vaccination Center between 8 a.m. and 9 a.m. without an appointment. This walk-in option is available for people 65 years of age and older, only those persons 65 years of age and older. And also, if you've not already done so, you need to download the WeHealth app, which is designed to help slow the spread of COVID-19 by anonymously notifying app users of potential exposure to COVID-19. Once we have the virus under control, we can relax the restrictions, but not until we have it under control. Please, everyone, do your part to help us get it under control. Thank you.
Thank you, Minister of Health. And again, I thank you and your team at the Ministry of Health and all of the women and men on the front lines working hard to help us manage this current outbreak. Bermuda, we are at a critical stage in our battle against the coronavirus. We have seen active cases continue to rise, and with that, an increase in hospitalizations, and sadly, 2 more lives lost to this virus. At the same time, we are poised to further expand our vaccination program. Though we acted to mitigate further spread, we are dealing with a highly transmissible variant that has transmitted rapidly prior to the implementation of the latest restrictions put in place last week. We have learned that we do not see the full impact of an outbreak in the community until about 2 to 3 weeks later, which is the point at which we see increased hospitalizations. This is where we are currently. In the same measure, when restrictions are implemented, we are not likely to see their true mitigation effect until at least 2 weeks after they were first introduced. The government is looking closely to see if the measures we have taken are having their expected effect in slowing the spread of the coronavirus and moving us to a place of a reduction of cases. We have seen evidence from previous outbreaks that these measures do work, and we have observed subtle indications that they are beginning to take effect in this current outbreak. The 7-day average of our positivity rate of testing, which saw sustained increases, peaked on April 2nd. But that trend can change quickly, as we saw higher positivity rates of 3.8 today, which is above the 7-day average. Our 7-day average, or the real-time reproductive number, has also started declining from a peak of 2.47 on March 23rd, now down today to 1.26. But the fact is that that is still too high, and that means that the virus is still spreading in the community and is not a position where we want to be. What this means is that it appears the mitigations put in place are having their intended effect. However, the situation remains delicate and can change quickly. Now, as much as ever, is a time for caution, cooperation, and continued vigilance. If we do see a continuing trend of decreasing new cases, decreasing in the positivity rates for testing, and a reduction in the R number, then it will confirm what we are doing now is working, and therefore we must continue on this path. The government is focused on making decisions that are based upon the data. Some have asked if further restrictions are imminent. In response, I will say that the government is determined to balance public health with safe and continued economic activity. We recognize that poverty is also a public health crisis in our world today, and that this pandemic has caused financial strain, increased anxiety, and certainly increased stress. With this in mind, we have no desire to increase restrictions, but as the government, we must take the decisions which are necessary and not just the ones that are convenient. And if we do begin to see an upward trend in case numbers and positivity rates, further measures will be implemented. The Cabinet will be meeting next week to consider the latest data, to see where we are, and will make announcements next week of any changes to not only the restrictions in place, but also differing measures that will be implemented at our borders. I will now speak briefly about education. The Ministry of Health regulations currently in place apply to all public and private schools. As there is no expectation that these will change in the next week, and therefore to ensure there is no disruption in learning services, all public and private schools will be requested to transition to remote learning starting on Monday, April 12th, until at least Friday, April 23rd. The Minister of Education will provide a full update on these measures during a press conference tomorrow at 5:30 p.m. We can all avoid having to go further with restrictions if we all do our parts. In addition to adhering to all regulations, join the 22,651 people who have downloaded the WeHealth app to assist our contact tracers and to help end this outbreak sooner. Continuing to increase our vaccination numbers is essential in our desire to bring normality back. As the Minister of Health announced, we've now administered 42,038 doses of the Pfizer-BioNTech vaccine as of yesterday. That means that 46% of our eligible population have already received at least one dose, and 46% of our eligible population is 38% of the total population. Also, 34% of our eligible population have now received both doses of the vaccine, which equates to 29% of our total population. I want to thank all those who have been vaccinated and all those who are registered and are awaiting their appointments. You have helped us to progress, but we still certainly have a lot of work to do. If you have not already done so, please register and help Bermuda move closer to its goal of herd immunity, with 70% of the population vaccinated and protected. And it's important, as the Minister of Health noted, vaccination is a community effort. And if we get to the point of herd immunity, that is when we can begin to start relaxing restrictions. But it is important until we get to that point that we continue. As I come to the close, I know that this is a difficult time for many individuals and businesses. For those who cannot currently work due to business closures, mandatory quarantine, the government is committed to supporting you through the unemployment benefit, which you can apply for at uba.gov.bn. For businesses affected by mandatory closures, if you have not already done so, you can apply for grants through the Bermuda Economic Development Corporation at bedc.bm. There is assistance available to your business. Also in cabinet today, the matter of parents unable to work due to the fact of schools switching to remote learning for at least the next 2 weeks after the holiday was discussed. That hardship is not lost on us, and we are working on a solution which we'll be able to discuss and announce next week. But parents, I understand the inconvenience this was caused, but what we are determined to do is to make sure that we keep the country safe and end this current outbreak. I also understand that this outbreak is causing additional anxiety, stress, fear, and loneliness. For those persons, the Emotionally Wellbeing Hotline is now open Monday, Wednesday, Friday, and Saturday from 5 p.m. to 9 p.m. If you or anyone you know requires extra emotional support, please call 543-1111. To anyone who is going through a difficult time, please do not suffer in silence. There are people who are here to listen and want to help you if you are in need. Useful information on how to cope with stress, as well as a list of psychologists you can book a private appointment with, can also be found on Bermuda Psychology Association's website at bermudapsychology.com. As a reminder, to get accurate, reliable, and timely information, please subscribe to the government's WhatsApp service, which is operated every day and sends out information about the coronavirus and other government matters. That phone number is 504-6045. Add it to your contacts and send us a simple message saying hi, and you will receive messages from the government of Bermuda. Again, that number is 504-6045. You can also get updates from downloading the TreeFog app, which is available in your app store. Now, the Minister of Health, myself, the Minister of Education, Chief Medical Officer, and also Dr. Wesley Miller, the Chief of Staff of the Bermuda Hospitals Board, are welcome to take any questions that members of the media may have on behalf of the people of Bermuda. Thank you.
Thank you, Premier. And I've just admitted TNN, and they will be live in just a moment. TNN, you are live. Please ask your questions.
Thank you, and top of the evening to you. Premier or Minister of Health, there seems to be a lot of individuals that are in the community still in quarantine, some that have been in quarantine coming up to 3 weeks now, and they have been told to remain in quarantine until they get their notification from the government health department. Some have indicated that they have had 2 tests, both negative. The question is, what is the purpose of the 14-day quarantine, double testing, and this doesn't seem to be working? Why such hiccups?
Trevor, I wouldn't say it's hiccups, but actually you have the benefit of the Chief Medical Officer here, and I think he would be best suited to answer your question.
Good afternoon, Trevor.
Yes, sir.
I'm not quite sure of the specifics of the cases you referred to. Most people are released after 14 days quarantine. What's in
But this is coming from a family that is their nursery school has been quarantined. A few nursery schools have been quarantined, and they have been in for 2 weeks, moving into the 3rd week, and they're still being told they cannot, after getting 2 negative tests for the whole complete family, they're still been told to stay in.
Okay, so what I suspect has happened there, while not knowing the specifics of the case, is that there may be multiple exposures that the family may have been exposed to, and we would work based on the last exposure. So that's why the quarantine period may be longer than 14 days. But the important point to say is that the 2 negative tests, you should have a test when you're going into quarantine and at the end of quarantine. You should not have tests in between the period because it just confuses things and it exposes people out, exposes the person in quarantine to the rest of the public. So that should not be the case. If you still have any questions, do feel free to get in touch with the epidemiology service. I will be able to give you specific advice based on the situation for the individuals concerned.
If I may also, Trevor, I think that it's important to remember that individuals who are in mandatory quarantine and are unable to work from home are eligible to receive support from the government of Bermuda, and they can go to uba.gov.bm to apply for that support.
Thank you. My next question, why is contact tracing, first contact is taking so long? I have an individual that said that they've been home, tested positive since March 26th, and they have still not been contacted by the contact tracers via email or any other means of getting a hold of these individuals.
Pandemic was first identified last year, March. The contact tracers are doing their best. The international standards, I believe, suggest 70% or making contact with an individual within WHO within 70%, within 24 hours of contact of the case being identified. And we are doing it with an 80% success rate. However, having said that, we do have some challenges as it relates to contacting all individuals. What we are asking people, particularly those persons that have a physician, the physician will first be the first line of contact, and they will contact the individual, indicate that they are positive, and give them instructions, which is to isolate. I'm certain that there's probably not many people in the community that don't recognize that if you are identified as a positive case, the first thing you need to do is isolate.
Thank you.
If I could just say the specifics, I'll let the CMO speak to something, because Trevor, you're raising a specific case and you're saying someone has been in contact in 11 days. That doesn't seem to be in keeping with what the Ministry of Health is doing. There's people who have tested positive, and then there's contacts of positive cases. Contacts may be a little bit shorter, but I would find it incredibly hard to believe that an individual hasn't been contacted 11 days after testing positive. CMO, could you speak to that?
Yes, again, without knowing the specifics, it's difficult to comment on the individual cases. So the minister is absolutely right. On receipt of a positive test, the individual's doctor contacts them and lets them know about their test and gives them the initial instructions on isolation, and also the initial instructions on how to get the list of their close contacts. So that's what happens normally. Because of the sheer numbers that we're dealing with at this point in time, there may be one or two that may have missed, passed through the cracks, but I can't speak to it unless I know the specifics. So again, please get in touch with the epidemiology unit, send us an email and we would investigate.
Yeah, I appreciate that. I refuse to put these persons' information, public information, over the airways, but I'm sure they're listening. Premier, my question is...
Before you go to your next question, Trevor, CMO, what is that email address?
I'll send that to you before the end of this conference. I don't have the specific email address at hand at the moment, but I'll get that to you before the end of the conference.
Thank you.
Premier, my next question, is there any possibility that government will allow people to withdraw more funds from their pension, as it has almost been a year? It's been coming up on a year for those who have got funds last year and still struggling over and over again. And things are becoming extremely tight for a lot of people. And is there any update, a second part, any updates to the mortgage situation for a lot of these people that are going through financial issues?
Thank you. On the first matter, in regards to the possible pension, it is a matter that has been discussed. No decision has been made as yet. It is under examination. And on the second issue, the matter remains as the answer that was given last week. It is something that continued discussion taking place. There's a discussion in cabinet and regarding the specifics around matters dealing with evictions. And I think you'll hear further things from the government this week and next week on that.
Appreciate that. I guess the number one question in the community right now, CMO or Minister of Health, do you have data or statistics on how many persons that have been tested positive in this latest outbreak has had the one shot or both shots of the vaccine?
Trevor, before I use the CMO, that email address, Trevor, is epidemiology@gov.bm. CMO?
Yes, thank you. So as of Monday last week, we had a total of 49 people who've had at least one dose of the vaccine who've tested positive for COVID-19. And then for 2 doses, we have 36 people who've tested positive. However, if you actually break it down to people who've been fully immunized, that is having 2 doses and at least 2 weeks after the last dose, we only have 23 people. But if you look at that and look at the people with actually very low CP values, and that is an indicator of how symptomatic or how they can how easy it is for them to transmit the virus. That number comes down to 3.
Okay, so how do you comfort the community that has that's going through a lot of anxiety, thinking that the vaccine is contributing to this latest outbreak?
No, that is completely wrong. The vaccine is not contributing to this outbreak. The vaccine, in fact, is the way out of this outbreak. What we are finding is that, as I said, a small number of the positive cases that we have tested positive. And remember, we've never said that the vaccine will prevent you from having any infection. What we're saying is that the chances of you having serious infection requiring hospitalization greatly diminishes after you've had the vaccine. Also, in addition to that, because you don't get very ill, the chances that you are able to transmit this virus is a lot less. And therefore, when we have a sufficient number of people on the island vaccinated, what we'll find is dead-end infections protecting all of us. So suggesting that the vaccination is contributed to this outbreak is plain wrong.
Thank you. My last question. We seem to be getting conflicting information from contact tracers reference to nursery school persons that are still quarantined home. One tracer is telling individuals that they received negative testing and the whole family are out of quarantine on one note, and on another hand, another contact tracer is giving different information. How do you rectify these problems?
Is it the same family or different family?
This has just been sent to me. This is a completely different family.
Right. Okay. Well, each case is different. Each exposure is different, and each exposure or each case needs to be treated based on the exposure that they have. The contact tracers that we we have on island are extremely experienced people that would evaluate and do a risk assessment based on each individual case. So, what one family may find because of the context of the exposure will be completely different from what another family will get. So it's not useful comparing notes because you don't know the exposures.
Okay, thank you much.
Thank you. Thank you very much. And we will now have Media Maya as she comes into the meeting.
Hi,
Media Maya, go ahead, you're live.
thank you. Good evening, everyone. Maya Palacio here from Media Maya. My first question is actually just a clarity off of TNN's questions just now. Just want to confirm, CMO, if you can, did you say that out of the 670 active cases, 49 people have had 1 dose of the vaccine and 36 people have had 2 doses of the vaccine, and they are included in the 670 active cases?
No, what I said was that as of Monday, that's all the active cases we had Monday last week. Those were the figures I was given.
Okay.
So not for, so the figures will change, as you would appreciate, because the outbreak is progressing.
Okay, sorry.
If I may, Maya, while you're looking for your next statement, I think what's most important to recognize on this line of questioning that both Trevor had and also this, I know that there's, as the CMO very rightly said, that there's just some fake narratives circulating in the community that the injections can cause coronavirus. It is absolutely false and it's not scientifically possible. So that's where we need to start. But the second thing, which is very important, is to speak about the facts of which the CMO had laid out. The CMO had said that out of all those persons that were inside of that group, only 3 persons who have been truly immunized were at risk of possible transmitting the virus or had levels of virus in their system that would make it likely that they could transmit. And so I think that's what's important to recognize. So out of that massive group, there's an even smaller group of people who've been immunized and even a smaller group of those persons who are. So if you just extrapolate that against the entire population and get yourself to a place of 70%, then you will have less infections, you will have less transmission, and you will have less people able to transmit. And that's what the government is going to be acting upon.
Okay, thank you very much. I do want to make a clarity that I had to mute when Trevor was speaking in order to come onto this, so I'm sorry if I missed anything. So I'm just going to stick with the questions that I have for clarity moving forward. My first or second question, how many of the 27 people currently in the hospital are persons who have been vaccinated either with 1 dose or fully immunized?
Yeah, so I don't know about the latest people yet because we're still putting the data together, but of the had 1 dose of the vaccine, and the description of their illness suggested that they were actually incubating the virus when they had the vaccine. So it's important to know that none of the people who are in the hospital and seriously ill is getting vaccinated.
And if I may, Ms. Palacio, in your
Maya?
question, you had asked 27. It was 21 in hospital, 6 in intensive care, not 27 in total.
Okay, thank you very much. 21 in hospital, 6 intensive. My third question, what is the difference between a COVID death and a COVID-related death? Can you give an example of each?
Okay, well, those questions, I mean, those terms are quite, have different meanings to different people. But what we work with in Bermuda is deaths due to COVID. And there are a couple of factors that we look at, and is that there is, for our surveillance purposes, we're looking for things that we have a death from a clinically compatible illness in somebody with a probable or confirmed COVID diagnosis, unless we find a clear explanation for the death. So for instance, somebody had a road traffic accident and died from that, then that's not considered a COVID death. And then crucially, there is no recovery before the person dies. So those are the things that we look at. Choosing those terminologies, different parts of the world have different ways in which they use those terminologies, but we stick to the WHO definition for calculating our deaths.
Okay. And my fourth question would be then, what are the symptoms or underlying issues that the majority of the Bermuda's COVID-related deaths have?
Maya, thank you for that question. You would know from similar questions asked in the past that in order to preserve and protect the confidentiality of patients, we do not disclose those minutiae of details. It's been asked before, and we've never done it, so we're not going to start in this particular case, but we can speak generalities and I'll pass on to Aya, but we're not going to speak specifics.
Absolutely. Thank you, Minister. It's important to know that there are people on admission at the hospital at the moment who don't have any underlying medical conditions. So it's not a given that the people who are in hospital have underlying medical conditions. The best way to protect yourself, as all of us have been saying, is to get vaccinated and keep to the public health and social measures. And that is the best way to keep yourself from the harms that can come from this disease.
Thank you very much. My next question, my fifth question is for Minister Urbane. Will student camps for essential workers still be available?
Maya, and thank you for asking that question. I do know that student camps for essential workers were made available for this week through the Department of Youth and Sport. And the idea is that we will look into how that can work over the next 2 weeks of this remote learning.
Okay, thank you. And my final question for the evening, which has probably already been answered in past conferences, but what events or outbreaks led to the Bermuda's current third spike?
Yeah, you're right. It has been asked previously, and I'll take pleasure in repeating it. It was selfish behavior by a number of individuals who chose to socialize in large groups without having the opportunity, without exercising the public health measures such as wearing of masks and physical distancing and the like. Once the curfew was lifted, we noticed several weeks later that there was an increase of outbreaks and physical distancing.
Thank you very much. Those are my questions.
Thank you very much, Media Maya. And now we'll bring on Island Stats with Earl Baisden. Mr. Baisden.
COVID-19 cases that have been confirmed around the SailGP event thus far?
I can't speak to that. I'm not certain if anyone would be able to clarify.
Okay.
I'm not aware of any.
Okay. All right. So, is there a way to find this out? How do we know? Or we know that people. It was mentioned that 6 people had come in with it. Where are they staying? What are they? Are they associated with the event? We seem to have numbers of how many people come for an event, but we can't have numbers of how many people are here for the event.
Earl, I guess the question of which you're asking is, don't know. The only thing I can say is that only 1 out of the 6 was a non-resident. So, I mean, I don't know if we'll disclose specific information on specific cases. I don't think we ever have. But as the CMO had said, not to the best of his knowledge, and it's not to my knowledge either. Nothing has come to my desk in regards to that. 6 imported cases that the minister announced. Only 1 of those cases was a non-resident.
Okay. Next question would be, who's actually conducting the daily testing of the event for the people, including the Bermudians that are in and around the event thus far?
Those are did through the PROTS post office. Well, the PROTS testing center.
Okay. All right. Can I just add to last week, the Premier did say that these people were having stringent tests done, and pretty much, I wouldn't say every day, but more.
Number of private institutions which are doing tests, and I can get that information for you to find out who exactly is administering the tests. Okay.
All right. The last question, I guess, to the Premier that I have. When it came to local sports being allowed to return, one of the requirements was that no fans be allowed. So my question would be, how are we able to sell tickets at an event that primarily will be unsupervised on the water?
I'm not sure what tickets you can be sold to an event that's taking place on the water. as there
Tickets are being sold, they're advertising tickets being sold on the water.
tickets sold for what?
For
You're
being
asking
on
information.
boats.
Earl, just for 1 second. You're asking information on the assumption that I know what you're asking about. So that's what I'm saying. Sold for what? The event village is apply with what the regulations exist right now. And the regulations that exist right now are only for 10 persons in any particular group. So I'm uncertain as to, as I said, I haven't seen what you're asking me, so it'll be difficult for me to respond specifically. So I'm asking, if you want to say specifically, I'm reading from this is what I have, et cetera, then I can respond to that. But what I have said previously is that the regulations which are in place in the country apply to everyone. They don't apply just to one group or another group or another group. They apply to everyone. And at this point in time, there are no gatherings that are greater than 10 persons. The only places where those things are allowed are, for instance, if you go to a restaurant, the people are seated and there's maximum 6 to a table, ventilation, only outdoor dining, those type of things. So the regulations are the same all over the place. I guess you're talking about local competitive team sports. And what I would say is that that is always based upon an assessment, which is done from the Ministry of Health. And so where we are is that we are looking to get to a place where we end this outbreak. And that means that our positivity rates need to go below 1 consistently. It means that our incidence rates need to go below, I think, I don't want to get the number wrong. Our incidence rates need to go below a certain amount. I think it is less than 10 per 100,000 population. I think that's the incidence rate we're trying to go to. And our R number needs to be consistently not only just below 1, but well below 1, so we're not seeing an expansion of the virus here. At that point in time, we could say that the outbreak is over. It will match in with the declining rates, will match in with increasing vaccination rates. But until that time, it's not a time where, for instance, you can see, I would say, close contact sports, which have certainly higher things. Right now, there's tennis that's taking place. There's golf that's taking place. It's not that all sports in the country have been stopped. Golf is taking place, tennis is taking place, things which are not at high risk of transmission. But if you're talking about rugby, or if you're talking about football, those are things where persons are far more closer. There's far more ability for the transmission of a virus. So in saying all of those things, I would say the rules apply to everyone. And if you have specific instances or questions, please go ahead and submit the specific instances and we can attempt to answer. And if there's something that is outside of the law, then that outside of the law will not be allowed.
Okay, then I would ask you to log on to SailGP Bermuda and click where they are requesting tickets be sold for the water. That's why I was asking. I'm not making it up. I saw it.
Going on a boat to watch humpback whales. No more than 10 allowed to vote under current restrictions. And the restrictions apply to all, Earl, and that's what I'm trying to say. So the restrictions are not different. There are not permissions that have been issued for large events, and large event permissions are the same.
Okay. I'll try to log on and see if I can get how many people. It doesn't say on the post, it just says to sell tickets for tickets. So okay. Thank you.
Thank you very much. And we now have Don Burgess for Bermuda Broadcasting. And as he comes online, Don Burgess, you're live. Please go with your question.
Thank you. Uncertainty, as we've talked about earlier tonight, remains about the full extent of protections provided by the vaccine. And while no vaccine is perfect, studies tell us it lessens the chance of catching and spreading the virus and protects against severe illness. In light of the current outbreak.
Oh, please let me go first.
Go for it, Minister.
Because Don, and thank you for this opportunity, Don, because you're safeguarding yourself, your family, and the community. As you've heard the CMO say, that the COVID will then come up with a dead end. And we're getting the vaccine, not just for those other persons that live in the community that are more vulnerable and that because of their own medical situations, they may be unable to get a vaccine. So this is all about our care for our common man and woman that live in this community. Sorry, CMO.
I think that they are absolutely right, Minister. You that's it. It's on several levels. First, you need to protect yourself. we just heard now that there's quite a few people who are on admission with this terrible disease in hospital. The best way you can actually reduce your risk of having serious disease is to be vaccinated and to keep to the social measure. And as the minister has pointed out, even beyond yourself, you need to think about the community that you live in. If enough people are vaccinated, what we'll have is dead-end infections, and we can all be protected. And thirdly, the economy of this country things can only go back to 2019 or earlier when sufficient number of people on this island are vaccinated. So I hope that helps.
All right, thank you. I was sorry, I was having audio issues earlier, but could you reiterate the number of people out of the active cases who've had 1 dose, 2 doses, and are 2 doses and 2 weeks, so they're fully immunized? And how do these rates compare to the regular rate of being infected?
Sorry, I was muted. No, I did not give rates. I only gave counts. And that's an important distinction. So again, because the numbers are quite fluid and things are moving around, it's probably not a good time to give the rates yet. So as of Monday, 29th of March, we had we looked at all the cases that had been we have seen since the beginning of this particular outbreak, and that a little bit before that, and there were a total of 666 cases. 49 of those have had at least one. Dose. 36 of those have had 2 doses, but not necessarily 2 weeks after the last dose. And if you look only at the people who've had 2 doses and at least 2 weeks after their last dose, the number drops down to 23. But of those 23, the proportion of the number of people of the 23 that have CP values, and that's an indication of how sick they are and how likely they are to be able to transmit this virus to other people, that number drops to 3. So only 3 people are have numbers low enough for us to be worried that they may be transmitting this virus to other people and have been fully vaccinated.
Okay, thank you. The CDC announced last week that vaccinated people were safe to travel and gather indoors with fully vaccinated people without wearing a mask. And the International Air Transport Association Travel Pass app rolls out on April 15th. Does the Bermuda government support vaccine incentives, and where do we stand on official vaccination certificates?
Thank you very much, Don. On the whole, there is a couple of things towards that. One of the things which we said inside of our statement today is that the government of Bermuda is going to act on data, and we're not going to hold ourselves to dates and other matters. The CMO has been incredibly cautious. The government of Bermuda is looking at formulating its own policy based on our situation here in the country and what it is that we want to do. There have been a number of meetings on this. There's going to be another discussion on this upcoming week. And the cabinet will get a paper to consider next week from both the Minister of Health and myself, dealing with the changes that may go into place for vaccinated travelers, vaccinated residents, and also changes to restrictions at the border for those persons who may not be vaccinated and are entering the country. So we are following our own approach. We recognize what the CDC are doing. We recognize what other places are doing. We're assessing the information we have here, the situation we have here, but we'll be prepared to make an announcement on that after cabinet makes a decision next week, Tuesday.
Okay, thank you. Bermuda Broadcasting has had 3 people tell us this past week that while they were on quarantine, no one checked on them. What's the normal protocol, and is this a resource problem?
Don, insofar as checking on them, I know that previously when we had, did not have community transmission, they would have had, when we had much lower cases, there would have been persons that would have contacted them just to see how they're doing, et cetera. We are in a state of community transmission. Each contact tracer probably has, each case has between 10 and 20 contacts. You heard me speak about an individual the other day who had 81 close contacts. So the reality of the situation is, in addition to the fact that the contact tracers, are burdened, but they are contacting individuals to say, you are isolated, you must stay in isolation, et cetera. So that information is being passed on, but they're also including in the communication, if you're not feeling well, call your physician. And we're also, as I think I mentioned previously, physicians are also stepping up and assisting with respect to this by taking care of their own patients, so to speak, and so that they can access the rest quest and see which one of their patients have been identified as a case, make contact with their patient and provide them with the requisite skill and attention that would be required of their doctors.
Okay, thank you. Just to go back to vaccination and easing of protocols, many countries may shortly be moving to a vaccinated, non-vaccinated policy and protocols. Would requiring vaccination for entry to Bermuda elevate us above the competition and offset the problems associated with our CDC level 4 classification?
Don, the only thing I can say is that the cabinet is going to be considering a paper that has been subject of a number of weeks of discussion on this issue around what we're going to do regarding changes to our borders in light of immunizations widely available in our gateway markets, in addition to the changes in all persons who are able to get a vaccine to go ahead and get the vaccine so we can reach the herd immunity so that the virus be stopped dead in its tracks, along with or meet dead ends, along with increased protection of our borders, things which I intimated to last week about the fact that immunized will be confirmed next week.
Okay, thank you. My last question for the night. How are we tracking long COVID and what symptoms are these people experiencing?
I think this is one for Dr. Miller.
We're good. We can hear you, Dr. Miller.
Okay, can you hear me?
Yep.
Yes, certainly. Thank you very much for that question. Well, from the hospital point of view, our first concern is the acute aspect of COVID, second problem. But I come back to the point that has been mentioned by the Premier and by the Minister, as well as Dr. Ayoola. The key thing is for individuals to get vaccinated, because what we do know about long COVID from other jurisdictions that have had a lot more cases of COVID and hence more of the long COVID is that the individuals who are vaccinated are less likely to get COVID-19. And if they do, they have less symptoms. And therefore the expectation is that we will see fewer of them developing the severe breathlessness.
Okay, thank you very much. I appreciate everyone's time tonight.
Thank you, Don.
Thank you, Don Burgess. And now we'll bring in the World Gazette.
All right.
World Gazette, you're live. Go ahead and ask your question.
All right. Thank you. Can you see me and or hear me, folks?
We can hear you.
We can hear you clearly.
All right. Perfect. All right. Good evening. And thanks for having us. Jonathan Bell from the Gazette tuning in. I guess to start with, in terms of if we should have to revert to lockdown, shelter in place, as you call it, the stricter measures, I guess could you tell us about what the threshold would be in terms of people in hospital or ICU? Are there specific indicators that you can tell us about when we would decide to tighten those restrictions if that were to come about?
The only thing I can say, Jonathan, is referring back to the statement of which I made, is that the government is going to be governed by data. And so there's a number of points to look at. Certainly, there is the capacity at our hospital. There's the capacity of our testing teams. There's the capacity of our contact tracer. And there's also the positivity rates inside the community. The thing is, what's important to note and to recognize is that any time you put in mitigations do not work instantly. They take 2 to 3 weeks to show their desired effect. What we believe are that we have had restrictions that have started with a curfew reintroduction, followed by what would be mirrored phase 3 restrictions, followed by implementation of phase 2 restrictions about 9 days ago. And so we need to give time to see for those things to work. There is some indication that things may be trending in the correct direction, but it's still too early to tell. And so as I said in my statement, the testing positivity rate was over a 7-day average, was slowly declining, but we've seen it today creep above that 7-day average with the results that were released today. We remain to see, and we're going to assess these over the next week. And when the cabinet goes to the date that we said we're going to review decisions next week Tuesday, we'll go ahead and have that revision and take stock from where we are right now. But it is important to note that we cannot make decisions just based upon where we are right now and to say that what we did before isn't working. You need to give time to make sure that the mitigations work. Working from home and closing schools are significant mitigations. They are not things that are done lightly in any way, shape, or form, but they are significant mitigations. The measures of which we put in place are significant mitigations insofar as basically closing anything indoors that does not require a mask, that requires you to remove a mask, which can increase the risk of transmission. That's where we are. We need to give time to see if those measures are working. And I don't know if the Minister of Health or CMO wish to add anything to that, but that's the position in which the government's taking. We're going to be following the data and making sure we make decisions based on data and not based solely on emotion.
Thank you. Are you able to tell us, open to anyone who can answer it, how many people do we have in quarantine right now? Or is there a latest figure on the number of people that we have in quarantine right now? Do we know, is there an estimate or an actual count of that could be shared?
Jonathan, it's probably in the thousands, actually. You see me sitting here in my at my house.
I do indeed.
Yeah.
But we don't have a figure on that?
No, it's like I said, if there's one individual that I spoke of that had 81 close contacts. So yeah,
okay.
Yeah. I mean, when we're talking about 600 plus active cases and assuming the majority of them live with 2 to 3 people, in their household, that's, 1,200 right there.
Righto. Okay, let's move on from that. I mean, it's looking on the outside that we're going to need to ramp up these vaccines. Is that a plan? And are there incentives? Is the word I can only think of. I don't know how you would do an incentive, but is there anything of that nature being contemplated to increase those numbers as quick as we can of people getting the vaccine?
As I indicated a few times earlier, Jonathan, is that the cabinet will be considering information from the Ministry of Health, the doctors discussing measures around the vaccine. We'll talk about incentives. There's financial incentives, which have been suggested by certain people inside the international community, looking at what the international business community, looking at what's taking place in other places. Others are incentives in regards to differing privileges that may be able to apply on island, which are other things which are under discussion and consideration, which are being examined for their legal basis and a legal review. And there's other types of discussions of which are taking place. So the view is that this is not something that we're going to go into quickly. We're going to assess it. I would have liked to have it announced 2 weeks ago. But the fact is that what we're making sure that we do is listen to the science, follow what the doctors have said, make sure we go back and forth to arrive at a position that can be broadly supported, and it has to be endorsed and blessed by the cabinet of the country. And so at this point in time, there are a number of options under consideration, and the aim of the timeline is to present those to the consideration of the full cabinet, the cabinet subcommittee next week, Monday, the full cabinet next week, Tuesday, and hopefully we'll be able to present an announcement at this time. Regarding the ramp up of the vaccination program, I'm sure the Minister of Health and CMO can speak to that.
Jonathan, yeah, we have seen last week in particular, we averaged 840 vaccinations a day, and that excluded Good Friday. So we are very, very satisfied with the increase in capacity that the vaccination centers, both at the Bermuda Hospital Board Vaccination Center, as well as the Bermuda College, the output measures are tremendous, and we're very, very pleased with what we're seeing. All we're doing is encouraging persons to register. If you register to get vaccinated, we can assure you we will put a shot in your arm. But the reality is that we're looking at what we can do to increase capacity. The AstraZeneca is probably getting ready to land any minute now, and that will allow us, because of the less restrictive cold chain requirements, that will enable us to provide to the physicians so that they can assist in administering the vaccination to their patients.
And Minister, I'm not sure if the AstraZeneca and COVAX is inside of your statements, but it is something that, Jonathan, the COVAX facility delivery has been confirmed, and there are how many doses of the AstraZeneca that's set to arrive today, CMO or Minister? There's
9,600 coming from COVAX and 100 coming from Public Health England.
Okay.
Today,
so
John.
That of course will allow the expansion of the program, as the Minister of Health has indicated, to be able to offer those to doctors and others. And I have been assured that the Ministry of Health has a full plan already, as they've been preparing for this for a while. So they have a full plan that will be able to scale up those things, in addition to mobile vaccination, to go into places where we see low vaccine take up in the community.
Can I just also add very quickly that we've just done a recent survey that suggested to us that the number of people who actively are refusing to have this vaccine is actually dropping. I think it's halved already. So what would happen going forward to the future is, if you choose not to have the vaccine, you will be in the minority, and you are actually making things bad for the rest of us.
Right. Sorry, Doctor, were you referring to the AstraZeneca vaccine there, or just vaccines in general? I know there's been some concern, not lately, but in the press from Europe over the AstraZeneca vaccine and some complications in a small number of people.
So our survey was about COVID vaccines in general, not about any specific vaccine.
About to get my second jab. I guess following on from that, it's becoming old news, but there was a while back, I just referenced it, there was some concerns in the European press, that's the only place I've heard it, to do with AstraZeneca. Do you have a plan in place to, I guess, assuage people on that? Do you have any concern over hesitancy? I know you don't like the term, but to do with that particular vaccine because of some of the issues that came up, at least in the press, to do with AstraZeneca?
I'll make a start. I'm sure Dr. Miller has something to contribute to that as well, but I'll make a start. So the first thing to say is that all the COVID vaccines that we will get on Ireland have been approved by very stringent regulatory authorities. They're all very safe and they're all very efficacious. All of them works. If they don't work, we won't have them on Ireland. The issues that you have talked about are extremely rare events that we just happen to have a cluster with some in some countries, particularly in Europe. These events are so rare that your risk of getting that from getting the blood clots from the vaccination is so small that it's almost not worth talking about. Compared to your risk of getting COVID, which is huge. So over 18 million people have taken the AstraZeneca vaccine so far. We only have a handful of cases where these clots have been found. And so in a normal year without the vaccines, you probably expect the same number. So I think on the balance of risk, you're by far better off getting the vaccine. Dr. Miller, I don't know if you want to add to that.
Yes, certainly. I support that. And one of the things that I would say in relation to the AstraZeneca vaccine or any of the others, we do get clotting, blood clots in the normal population. And really what they have found in some of these European studies, which weren't controlled studies, by the way, so they didn't have alternatives testing them against, was that the clots occurred mainly in females and mainly in the younger age group. However, confounding factors like the use of oral contraceptives or similar medication was not checked. And it's well known that you're more likely to get clots in that population. And furthermore, if they were on certain medication or certain drugs, like the oral contraceptives, that would also increase the risk of clots. So if we were to remove those confounding variables, there's probably no real case. I can see with the regulatory authorities that paused for a while to check on the situation, but since then most have now resumed the AstraZeneca vaccine because there was no real hard evidence to suggest that there was any true increased incidence of clots over and above what one would expect in a normal population.
Thank you for that. And Minister, just to clarify, you said we're getting that one today? Did I hear that right?
That's correct. It's scheduled to arrive this evening on the BA flight.
Fantastic. I wanted to ask the antibody testing that we hear about, is that something that's on our horizon? Is it realistic for us? Are we too small for it? Is it something we're looking at getting?
I'll let the CMO answer that, Jonathan.
All righty.
Yeah, we do have antibody tests on Ireland, and we've had that for several months now. The difference with antibody tests is that the interpretation is particularly difficult, and it can give all sorts of results that needs very specialist interpretation. So we at the moment are not using it outside epidemiological studies or in the hospital as part of studies to determine who should be given convalescent plasma. For the vast majority of the public, it is not a very useful test.
Okay, nice. That clears that up. I guess, Minister Wilson, I'll leave this as my last one. You said we could relax restrictions once COVID is under control. I guess, what does that look like? Again, are there specific indicators? Do we have any in place at the moment, or are we in a wait and see? What are we looking for to ease off on what we're at right now?
Jonathan, what we are looking at is, and you may recall that we've got on the website the lead and lag measures.
Sure.
And there are, as the Premier indicated, we are prefacing our decision-making on the data as opposed to dates. There was a conversation today with some of our cabinet colleagues, and it was to indicate to them that we will be producing data for them to be able to have fulsome discussion and consideration on decisions that need to be made, such as relaxing of the regulations and other measurements. So it's all going to be based on data, and we have to look at things like the positivity rate as well as the incident rate. And for example, the WHO classification for the positivity rate is less than 1. We're at 2.3%, so we're not anywhere there. And likewise for the incident rate, it's less than 10 and we're at 61. So those are the factors, that's the data that we will be looking at to guide our discussions and our deliberations with respect to the cabinet. As the Premier rightly said, we are listening to the science, and we're going to look at the data to support and the evidence to support our decisions. And in order for cabinet to provide a fulsome, have fulsome discussions and make proper decisions, I will be providing to them the requisite data as it relates to a number of factors so that we can determine whether or not we consider further restrictions and or relaxation.
Thanks, everyone. It's been a long day. Appreciate it.
Jonathan, just a quick follow-up to the Minister of Health. As I had indicated in answers previously, until we go below a 1% positivity rate, until we go below 10 under 1,000 for the incidence rate, and until we go below a RT number 7-day average under 1% for a sustained period of time, under 1 for a sustained period of time, the restrictions will remain in place. And that's where we are targeted. That's where the data is, and that's where the target is going to. So right now, things may be trending in the right direction, but we need to see that for a sustained period of time. It will be a while until we get to a 1% positivity rate. It'll be a while until we get to a 10 out of 1,000 incidence rate. It'll be a while until we have our 10 our RT number under 1 for a sustained period and point in time. And I think it's important to note that, and CMO, correct me if I'm wrong, that even if our RT number was at 1, but we are where we are right now, that means we have a significant number of active cases. That means each person passes it to another one, and that's not what we're trying to be. We're trying to be much lower than that, because that would mean that our incidence rate would still be high. So we need to drive all of those rates down, and that's what we're committed to do. So 1% positivity rate, at least 10 out of 1,000 for the incidence rate of the occurrence of the virus inside the community, and our real-time reproduction number 7-day average below 1. And those are the things that persons can look to before, and those are the measures that the government will look to before considering any change in the current restrictions. And so we're not going at it from a place of, we're going to look at it, we think we'll be there in 2 weeks, 3 weeks, 4 weeks. We're going to look at it as how the data presents itself before we make any of those considerations.
Thank you.
Thank you, Premier. Ministers, doctors, there are no more questions.
All right. Thank you very much, Anuranka. I want to thank the clinical staff of the hospital for joining us today. I know that there's a significant amount of work, energy, and effort which is taking place at the Bermuda Hospitals Board to care for persons. So, Dr. Miller, I want to thank you for the work which you and your team are certainly doing over there under challenging circumstances. CMO, I know that you are a little bit tired as you've been going for quite some time, but I want to thank you certainly for the work and efforts that you and your entire team have done. They are mirrored from the beginning to end of the process, and certainly it is our hope and desire as a cabinet that the measures of which we put in place will ease up some of the pressure on your teams in the coming weeks. Minister of Education, thank you for joining us, and I hope that all persons will tune in to the Minister of Education's press conference tomorrow at 5:30, which will be carried in the exact same place where we are right now. And Minister of Health, thank you continuously for leading the team on the front line of this pandemic. As I said, members of the public, we are in a difficult and dangerous situation still, and what is most needed is for us to adhere to the restrictions in place. If we all follow the restrictions, if we all continue to wear a mask, if we all continue to social distance, if we all continue to not mix households, we will reverse the numbers, we will reverse the trend, but it is up to us to make sure that we do that. So with that, I want to say thank you, Bermuda, and good night.
Join the over 21,480 people who are staying informed and helping stop the spread of COVID-19. Download the We Health Bermuda app right now. Once you download and install the app on your smartphone, the app will run in the background and alert you to any exposure risks. We are using the power of technology to defeat the coronavirus. Download the We Health Bermuda app today. This message was brought to you by the Ministry